Yeah, we should all be careful and avoiding this if we are over the age of 50 because we want a very heart healthy future. Like I have our EKG going on in the background. You want that remaining perfect. You don't want any issues with that. Well, has your doctor told you about certain over the counter medications you need to be really careful about over the age of 50 to have a strong, healthy heart and not any complications? And then I'm going to go into the one natural thing that I'll educate you about that I talk to my patients about for heart health, and it's very interesting. So first, let's go over what should you be very careful about. Well, it's oral decongestants. So that's we're talking about things that contain Sudafed, pseudoephedrine, phenylephrine. And where do you find those in? Well, you'll find them in cold medicines, allergy medicines, sinus medications, because these medications work to constrict blood vessels, particularly right here in the nasal passages, to reduce swelling and congestion. So, you want to be able to breathe through your nose when you have a cold and you don't feel well, or, you have to go to work and you don't want to be sniffling all day. But did you know you have to be really careful because these medications can increase blood pressure? Now, a lot of you that see a cardiologist and you're already on heart medications or blood pressure medications, you may already know about this, but I tell you what, there is a lot of people that don't realize that after the age of 50, you have to be careful about this. Now, I'm generalizing over 50 because that's when I feel we need to be a little bit more conscious of our heart. We have only so many heartbeats left on this planet over 50, right? But you may have heart disease being much younger. You absolutely would have to be careful with these medications as well. So, oral decongestants work by decreasing or constricting the blood vessel diameter in the nasal passages throughout the body also, not just the nose. So this can lead to sometimes dangerous increases in blood pressure. So even in individuals whose blood pressure is normally well controlled, they can all of a sudden have uncontrolled hypertension if they take medications that have these ingredients in it. And again, I listed pseudoephedrine and phenylephrine. So this risk is even greater for those that are already at risk for heart attack, stroke, and hypertensive crisis. So be aware of that. The other thing that can happen is a stimulant effect. So decongestion can also increase heart rate and can even trigger or even worsen heart arrhythmias. So that's when your heartbeat's not regular, you might have, palpitations, or you already have atrial fibrillation. Yeah, so it can lend itself to more irregularities. And that's why I always tell my patients, you really shouldn't be drinking Red Bulls or energy drinks, but that's a whole nother situation because that's caffeine, way too much caffeine. So these medications, did you know, could also interfere with your existing medications. So for example, decongestants can counteract the effects of lots of different blood pressure medications, and it'll make those medications less effective. So again, leads to uncontrolled hypertension or high blood pressure. So they can also interact with other heart medications. So you always want to ask your doctor, is it okay if I take this over-the-counter medicine? But we live in the age of AI. You can always list your medications in AI and list the other over-the-counter medicines you take and see if there's interactions. Okay. The other thing that these medications can affect is, my EKG went away. Well, hopefully it'll come back here in a second. Okay, so they can also affect things like if someone has glaucoma. For example, decongestants can increase intraocular eye pressure, and that's a big problem with people that have glaucoma. Heart disease, anyone that has a history of a heart attack, stroke, heart failure, or anything, oral decongestants can really put stress on the heart. And then enlarged prostate, men that suffer from benign prostatic hyperplasia, decongestants can worsen urinary retention and tighten the neck of the bladder. So it can make those conditions worse as well. And so in another video, I talked about why we have to be careful about anticholinergics because those medications, can lend to insomnia, nervousness, anxiety, and a whole host of things. But these cold medicines that have these decongestants in them, who knew, right? Did you know that? Okay, so common over the counter products to look out for. So, again, I'm not trying to beat up on these products. They can really be helpful for some people that it's safe for them to take. But, we're talking about your Dayquil, NyQuil, Sudafeds, your Tylenol, cold and flu. These may have the active ingredient phenylephrine or the other one, pseudoephedrine. So, I feel like a lot of the labels I look at, though, a lot of it nowadays is phenylephrine. Okay, so what's safe to do? Well, you may want to ask your doctor about this, but it's well known. And what I'm going to educate you on is saline nasal sprays or rinses are usually much safer. Now, again, I don't know your medical background. You always want to check this with your own doctor. But nasal sprays are great for flushing out mucus and reducing swelling. What I'll say about that is if people don't know, don't ever use tap water and don't ever use water where you don't know where it comes from. You always want to use actual saline or, they sell the safe versions in the grocery store because there are certain microbes that it can exist in tap water that's not treated well water, groundwater, pound water, and that can actually cause problems in the brain. I won't go into that now, but you have to be really careful with fresh water sources. Steroid nasal sprays, believe it or not, yeah, those are over the counter, like Flonase, Nasacort. Those are sometimes safer for those with heart histories, but again, you want to check with your doctor on that. Warm compresses to the nasal area, steam inhalation, and humidifiers. These are all alternatives to those medications to avoid the hypertensive and cardiovascular conditions, especially if you're over 50. Okay, so now switching gears. What is my favorite herb that I love to use for, I guess, the beginnings of problems in the heart? Like if it's just like the beginning of hypertension or some palpitations going on, improving heart muscle contraction and things like that. Now, again, I'm not telling you to do this. I am just educating you on this herb and what this herb can do. Always check with your own doctor first. So let's talk about and educate on hawthorn. Yeah, hawthorn, also known as the heart's best friend. Yeah, so hawthorn derives from the berries, leaves, and flowers of the Cretaceous species of plants. And the active compounds are flavonoids. So they have some other activities too, but that'll keep it simple. So how does this work? So hawthorn helps strengthen the contractions of the heart muscle. So your heart can more effectively pump blood throughout the body. And I love this with people that have mild to moderate congestive heart failure. Hawthorn also helps those with hypertension or high blood pressure because it helps relax and widen the blood vessels, therefore dropping blood pressure. It actually also helps supply blood to the heart, especially through the coronary arteries. And then this is great because you get improved blood flow, oxygen supply to the heart muscle, which is really great for people that suffer from angina, also known as chest pain. I love it for high blood pressure. Studies have shown there's a reduction in both the top number, the systolic, and the bottom number, diastolic blood pressure readings. I love that. And the cool thing about hawthorn is it's also an antioxidant and anti-inflammatory. That's right. So it's like many plant-based compounds. Hawthorn is rich in antioxidants, and it combats free radical damage, oxidative stress, chronic inflammation, and other major drivers of atherosclerosis and other heart diseases. I love how it also helps gently manage cholesterol, the bad or LDL cholesterol and triglyceride level. And I love that it helps regulate heart rhythm for those that suffer with arrhythmia, but more research is needed on that. So a lot of herbalists and even naturopathic physician, I'm a naturopathic medical doctor. I'm very familiar with hawthorn. It's so very safe for my patients. That's why you may want to ask your doctor about it. But hawthorn for years has been known to be great for chronic congestive heart failure. And there's so much robust scientific backing and research on this. Numerous studies, including meta-analyses, have shown that standard hawthorn extracts can help treat mild to moderate congestive heart failure. Love that. So that's where people have shortness of breath, exercise intolerance, fatigue. They get swelling in the lower extremity, in their legs. Yeah. People with chest pain, they really just need improve oxygen and blood flow to the heart. And I love that hawthorn can gently alleviate certain types of chest pain. And I love when I have a patient that's really reticent on getting on a high blood pressure medication because I'm like, well, we might just be able to start with hawthorn berry. And it's so safe. So I love that. So hawthorn, again, antioxidant, anti-inflammatory, vascular support. It has so many therapeutic effects. But the thing is, if you talk to your doctor and they're not familiar with hawthorn, they need to go slow and steady because hawthorn's effects are gradual. The effects build up over weeks and sometimes even months. So it's not a quick fix like some pharmaceutical drugs. And you cannot take hawthorn. Those that are on digoxin, also known as digitalis, there's a very serious interaction. You cannot take hawthorn because it potentiates the actions of digitalis. Hawthorn can also lower blood pressure. So if someone's already on blood pressure medications, they may not be also able to take hawthorn. And then the same thing with nitrates and antiarrhythmic drugs. So nitrates are those that help like nitroglycerin, right? People are on that for angina. And if you're on nitrates or certain types of heart medicine or high blood pressure medicine, you absolutely need to clear it through your doctor first, okay? Because it can react with certain medications. Okay, so hawthorn, is it a replacement for conventional medicine? No, I'm not saying that. But I sometimes have patients that do not want to be on any pharmaceutical drugs, and I have to find something natural for them. So side effects, hawthorn is generally well tolerated, but there are side effects like nausea, dizziness, fatigue, sweating, GI upset. But I feel like that's the side effects with most medications and herbs that you read the label on. Yeah. And, herbs, the quality control, it depends what brand you buy. So again, you always want to make sure you're working with your healthcare provider before you start taking something. Okay. So in summary, yeah, hawthorn is one of the most researched, evidence-based herbal medicines for cardiovascular health. I love it for patients over 50 that just want to maintain perfect heart health. And now you know about hawthorn. Okay, everyone, I'm Dr. Andrea O'Connor. Thanks for being here on Vitalize Health Partners. If you want more information, there's lots more videos on our channel. You can even see our website, vitalizehealthpartners.com. See you on the next one.